So smile makeovers using porcelain veneers. Tell me a little bit about the process. I mean, how do you help people know what their teeth are going to look like? That's my question.
This is probably the area that excites me and has excited me throughout my career. As I mentioned, I've been doing this for over 40 years.
All right.
And the one thing that I'm focused on that ties into everything that I do is comprehensive, preventative, restorative, and cosmetic treatment. So I look at teeth, gums, bite, and smile. Those are the four things that I look at and diagnose on every single patient. And obviously, when someone does not like their smile for whatever reason, they can either have gaps between their front teeth, or they're discolored, or they have old fillings that are failing. I've even had cases where patients have had veneers 10, 20 years ago, or even crowns, and they just wore them out. Okay. And so they want to continue to have that smile, that youthfulness, that feeling good about their smile, and how it makes them feel not just physically but also emotionally, mentally. Okay. And so that's the beauty of being able to cosmetically take a tooth that has a problem and restore it back to its beautiful natural appearance. And veneers or crowns is the way we do that. But it's a comprehensive type of an approach. You're looking at everything. It's not just the smile. It's not about teeth. It's about the patient's quality of life.
So if you don't like your smile,
and you're embarrassed,
do something about it,
or you're hiding it, or you're covering it up with your lips, you just don't feel as good as you want to be able to feel. We can change all of that with veneers.
So how do you show them what it's going to look like? I mean, do you have like computer imaging, or just you show them other before and after photos?
We have a lot of before and after cases, where we can show, I would say 90% of the time, I can show a patient another case just like them and show them the before picture, and they'll look at it, maybe it's just like this, we're just kind of showing the teeth, and they'll go, that looks just like me. Or we have pictures on the walls in the operatories, and they'll come in, and if they're really interested about the smile, they'll point at the picture on the wall and say, can I have that?
Okay.
And we say, absolutely, because that's what we do.
And veneers don't stain, is that right?
Veneers are porcelain, so they don't stain at all. Okay, so they're very permanent, and they last a long time.
So you can take somebody, they have pretty good teeth, crooked a little bit, right? So you use terms like instant orthodontics. So you can give people veneers over crooked teeth.
Yes, we also call it smile in a day.
Okay.
Because literally when we're prepping those teeth and doing the work, they walk out that day with their new smile. And it may be a temporary covering while we're making the permanent veneers in the lab. It's a laboratory procedure like a crown or anything else. But we also change the shade of their teeth. So if they had real dark or stained or teeth that they weren't happy with, their temporaries will be an improvement, and then their final veneers or crowns will be like incredible.
And for many people, you say this changes their life.
Changes their life.
Because now they're back smiling, feeling good again.
I mean, they'll, it's really interesting. They'll come in initially, and you can tell they're embarrassed. They're not happy. You do the treatment, you give them the beautiful smile. Now they'll come back in for a follow-up, and they'll have, there'll be makeup and hair done and more jewelry on and a new outfit. You can just tell they've got
their confidence goes up.
Their confidence goes up. Absolutely. It's amazing.